Okay, so a warm welcome to everybody joining us for today's ISNTD Connect session. Thank you very much to our wonderful speakers for today. The session for today, we've titled it, It's Viral, Lessons from Social Media and Vaccine Hesitancy. We're very honored, delighted to be joined today by Professor Heidi Larson, one of the founding directors at the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine, as well as the Advisory Council on the Vaccine Confidence Fund. Dr. Shaffi Fazaludeen Koya from the Global Institute of Public Health at Boston University. Professor Charles Shey Wiysonge from the director of the Cochrane in South Africa, as well as the South African Medical Research Council. And also Dr. Stephen Lloyd Wilson from Brandeis University and the Digital Society Project out in Boston. So thank you very much. A warm welcome to the panelists, and we'll be coming to the presentations in a couple of seconds. It's a huge topic, vaccine hesitancy, vaccine confidence, very relevant to our kind of lives at the moment with this COVID backdrop that we're all living through. We've kind of reached a paradox where the G7 countries have more than enough doses to vaccinate the public in multiple times, so more doses than the actual people in the countries for the G7. The paradox lies in the fact that even though they are flourishing democracies, that the G7 moniker kind of implies that in its own right, where in those kind of situations, health outcomes for the public, incomes, the prosperity, it's all kind of baked into that model. The paradox lies that it's in those countries where vaccine hesitancy seems to have taken root, and a lot of this is in part catalyzed by social media interactions, which kind of leads to huge kind of existential questions in terms of how do you regulate that, whose responsibility is that? And we wanted to kind of open up all of that, the relationship between social media and this whole thing around, this whole phenomenon around vaccine hesitancy, and perhaps even see how it morphs from vaccine, how people turn from vaccine hesitant to vaccine resistant. It's very much in the news. I mean, only today, outside of social media, some of the kind of the news coverages we were seeing today are there's been a checklist sent by anti-vaxxers to headmasters across various schools in the UK, where they're asking, it was picked up in The Guardian this morning, where the checklist isn't what it seems. It's basically misinformation points around the vaccine, and in some cases they're being sent to school as an official with an NHS logo, and it's just used to further that kind of anti-vax stance. It's very topical. This isn't just something it's a phenomenon that we're covering or looking at. This is affecting people's lives, and it's something that needs to be unpacked and explored. So we're very delighted, honored with this panel. So I think that's enough from me. I think we'll move to the first speaker, and for that I'm going to introduce Dr. Stephen Lloyd Wilson, as we said earlier, from the Brandeis University and the Digital Society Project. Stephen, over to you for the first presentation.
All right, thank you very much for the introduction, and thank you for having me here. This is a very important project, and it's always nice as a social scientist to actually get to do something that matters in the real world from a certain perspective, and this is definitely that. So I'm going to try to turn on my slideshow here, so hopefully you'll all see slides in a second.
Yeah, perfect. We've got them. Yeah.
All right. Okay, so this is me, and Prof. Charles is my co-author, and he's also on the call, and he'll be around for any questions for the things that I don't know anything about. And that button doesn't work. Okay, there we go. Just figuring out the interface for the first time. Okay, so basically the motivation for this project is, of course, the connection between social media and vaccine hesitancy. So kind of a short summary of the pieces of the puzzle that we already knew something about, right? So the first kind of element is the role of social media and the internet and the rise of extremism in general. And so this sort of effect goes hand in hand with what we call the long tail effect, which some of you might be familiar with colloquially in other uses with the internet. But it's basically this idea that because communication is free and easy, rarer things can actually take root. So the economic example is that brick and mortar bookstores can't stock every single book in existence because their warehouse is only so big. They can't afford to stock the book on hand that only 1 in 10,000 people would ever buy. And that's not a problem for online sellers of books, for instance, because they can have, no matter how rare it is, room in their infinite warehouses out there for you to find. What we've seen happen in the political situation is what this has meant is that rarer political opinions, like fringe political opinion, can find root and find other people. So things that might have been appealing to 1 in 1,000 people, but they'd never find a fellow conspiracy theorist to talk with over coffee, can find other 1 in 1,000 people via the internet. And so what we're seeing is a phenomenon that we call extremist outbidding, where these rare fringe ideas can start to get traction, can find each other, can organize, and then can communicate as if they're larger. And the way that outbidding works politically is this idea that there's an incentive in fringe politics to be as extreme as possible in order to sway the middle on the risks. So the terminology comes out of ethnic violence, where an ethnic extremist will take office by insisting that the people of ethnic group A are terrible people who are going to come into your homes and do terrible things at night, et cetera, et cetera. And most people don't believe this, but even on the very off chance it happens, it's so terrible, I'm going to vaguely be hesitant about them. And we can kind of see that exact same phenomenon with anti-vaccination, where it's not a matter, for the most part, of people read something and say, aha, a vaccine is terrible. Like, there's definitely people that are like that. But the real problem is that long tail of, well, I'm going to be hesitant about it because I don't really buy what they're saying, but the effects seem so bad, I'm a little hesitant about immediately jumping in and doing this. The secondary thing we can talk about is disinformation campaigns in general. So sort of the additional dimension of the issues raised by social media and the internet is that malicious actors are using this long tail effect and extremist outbidding to spread things that are false and causing all sorts of problems. And this is intersected especially with anti-vaccination concerns even before the rise of COVID, with the targeting of aid workers in Africa during the Ebola outbreaks of 2014 and 2019, the growth of the anti-vaccination movement in general in the developing world, and then of course during the COVID period. So what we sort of set out to do is we wanted to test these relationships on a large and cross-country basis, so across as many countries as possible, because there's been a ton of really good research done on handfuls of countries or a couple of case study style countries really teasing out these mechanisms, but there hadn't to date that we knew of done kind of testing these mechanisms to see what is the actual effect of these things worldwide over the long term. Sorry, I keep hitting page down, and page down does not work in this interface. So what we need to measure in order to do this is a couple things. So dependent variables, the outcomes that we want to test are vaccine hesitancy, and then slightly differently, actual vaccination outcomes to kind of tease, like split the hairs of that difference between it might cause hesitancy, but does it actually cause less vaccination to happen? And then an additional sort of mechanism of negative discussion of vaccination online. And then our causal variables or independent variables being the level of social media usage in a country and the level of disinformation on social media. And as you might guess, some of these things are not very easy to just look up on Wikipedia. So we had to be relatively creative on how do we measure these things. So first of all, vaccine hesitancy, we found an excellent data set from the Wellcome Global Monitor that did large cross-country surveys with individuals in 137 countries on various elements of vaccine hesitancy, which we used as one sort of point in the equation. Unfortunately, this didn't have like a before and after, so like in 2010 versus 2020. So we couldn't use this data as a cause and effect thing, right? In terms of it used to be this way, social media happened, and now it's this way. But it gave us some insight into it in general. The second thing that we did is looking at vaccine outcomes in general. So the WHO tracks and has a lot of data on vaccination rates. And so what we did was generate just a kind of aggregate measure of the top 10 most common vaccines used across the world and produce an aggregate measure of what is the average, the mean vaccination rate across these 10, just to account for the fact that there's occasional ones that aren't in one country or the other. And we didn't want that to idiosyncratically sort of determine what was happening. And so that gave us a general look at what is the level of vaccination. And this was available on a time series basis. So in particular, we looked at 2008's levels across countries versus 2018, so that we could basically have the decade of social media, rise of social media and disinformation as sort of the treatment effect going on. And mind you, all of the work that we had done was actually before COVID. We actually had the meeting discussing this paper initially in early February 2020. So that was a interesting coincidence. In order to measure a bunch of this information about social media, we draw upon this other project that I have that has been collecting all of the geocoded tweets in the world going back to 2011. We've got about 7.5 billion tweets. All of these are the tweets that have like a location attached to them. And so we identify the country of origins for every one of them. And we use this for the purposes of identifying negative conversation about vaccination on social media. Now, Twitter is used differentially in different countries, but being able to look at individual countries over time and how levels are changing should control for that to a certain degree. And to just give you something beyond words on a slide, some pictures of what's going on here, some evidence of stuff actually happening with people actually using social media to discuss vaccination and disease and such. This is a graph time series of Farsi tweets, so Persian, Iranian language, per day with two lines, one talking about Corona or COVID, the other talking about election keywords. And this February 20th, 21st here with the orange spike, that was the Iranian national elections. And so people are discussing vaccination and COVID at a higher rate than the elections on the day of the national election, just to kind of give some insight into people really are using it, and we're seeing that in the data. And to give you sort of a going back several years in terms of discussion of vaccination in our big tweet database, this is the number of times vaccine in basically the top 20 languages worldwide is used around the world. And you see it's a relatively low rumble for a long period of time. And then something happens in March 2020 where people start talking about vaccination a lot on Twitter. And then it really spikes in autumn 2020 when the first vaccines start to be tested. Okay. We additionally, in order to measure things like disinformation, drew upon this additional project of mine called the Digital Society Project that I have with a few other scholars that uses the VDEM project as a model, if you're familiar with that. But basically the gist of it is to measure quantifiable, objectively knowable things like whether or not people will be arrested for posting stuff online, how frequently people use social media to organize offline action is one variable we use in particular. That there isn't a way to just look up these things in a data set. And the way that we do it is we survey experts from the countries involved. So we have 3,200 scholars in a network worldwide, 65% are in country, virtually all of them have PhDs, and do a bunch of statistical stuff to ask them various questions that I'll I'll glaze over the statistical side of that. And here's my obligatory, here's our data, it's a really cool slide. We've got 35 indicators about various things about the intersection of politics and the internet. This is the way that this interface looks for an expert is they're coding. This, for example, is the false information question, where they're asked how often is false information disseminated online by the government, and then it has several Likert scale options that are weighted in order for them to answer. So to kind of give you a gist of this foreign disinformation variable and what it looks like, we see sort of the extremely often category is 2 or 3 states at this point. The often most political key issues category is 13 countries, with the US being 13th worst if you care about that cornerstone, and then 42 countries are on some of that some category. So this is a major problem worldwide. It's not just a handful of countries that are being targeted with foreign disinformation. Okay. So to kind of get into the effect side of things, where this is how we measured all of this stuff, do we actually see an effect at all? And the answer is staggering and depressing. We were surprised at how large the effect was once we actually started doing this. And all of these results graphs that I'm showing, they're all done through proper regression frameworks with tons of control variables that I'm happy to talk about ad nauseum, but just sort of on the summary side of things, showing you the effect over a 10-year period of disinformation, level of foreign disinformation in a country on the actual outcome of vaccination rates is at the tipping end of the scale is nearly 8 points in terms of that 0 to 100% mean vaccination rate across the large common vaccination packages over this 10-year period. So it's not just a statistically significant, it's a very substantively significant result of at that peak end of on the order of several percentage points worth of drop in vaccination. And then the other thing I wanted to show you is we had, I neglect to mention that same project that measured level of foreign disinformation, one of our 35 indicators is the frequency with which individuals organize offline action on social media. So that's kind of a direct measure of how often is social media being used for purposes of organization, which is sort of getting at a measure of that long tail effect that we talked about at the beginning, in terms of are people actually using social media to self-organize, which puts us at a risk for extremist outbidding. And I just sort of categorize this here into countries where they do it regularly versus often down to never, versus going off of the Wellcome survey's percentages of population believing vaccines are unsafe. And we see a very, very stark setup here, where the countries where people simply never use social media to organize offline, there's basically nobody who thinks vaccines are unsafe. And parsing up where there's this clear relationship where the more social media is used, the higher a percentage of the country believes that vaccines are unsafe, which goes hand in hand with a lot of our perceptions about how the major anti-vaccination misinformation and work is coming out of the developing world, not out of any case of being in the developed world where there's a lack of education systematically or anything else. So that really kind of picks up across the board these exact patterns that we were kind of scared to find. And I'll leave it off there unless Charles has something to add that I missed something glaring, or we can pass it off to the next presenter.
Thank you very, very much for that, Stephen. And Charles, do you want to add anything to that, or are we going to bring you in on the Q&A?
That's fine. Yeah, thank you.
I think that's a wonderful piece of research. We tracked that, and that's why we contacted you in terms of bringing this kind of out into a wider audience. Very interesting indeed. This USES DEM project that you mentioned, in this digital open society project, there really has been the rise in political populism, and I suppose it's been matched by the rise in populism within science as a kind of parallel stream. So very interesting that you're using those types of tools, and I'm sure we've already started getting some questions in from the audience, which will come through at the Q&A. And I'll just turn to the audience for a second and say, warm welcome to everyone joining us. What I would ask, if you could kindly give your name and organization and country from which you kind of logged in from, that would be really helpful. A shout out to Kenneth Hartigan-Go, who's joining us from all the way in the Philippines, Dimitar Tonev, who's also sent in some questions for us, Bernard Nafs, and all the wonderful audience that have kind of assembled today. To answer Mary Abba, we will be this is being recorded and we will release it after. Hope that answers your questions. And I would say to the audience, please do send in your questions for our panelists. It will make for a very interactive and lively Q&A. But thank you very, very much, Stephen, for that. Wonderful presentation and some really big points covered in that, probably reflective of the huge data sets. You think you mentioned 7.5 billion tweets that you've tracked as part of that work. So quite an amazing a bit of work. So thank you for presenting that. That takes us on to the next speaker that we have, Dr. Shaffi Fazaludeen Koya from the Global Public Health at Boston University. It was a paper that we kind of picked up on in the BMJ, social media, vaccine hesitancy and trust deficit in immunization programs, a qualitative inquiry in the Malappuram district of Kerala, India. And on that paper, it's the authors come from the Ministry of Health Saudi. They're also listing Boston as well as the University of Kerala. I know we're being joined by quite a few people from the University of Kerala today, and hi there to you all. I think that's enough for me, and I think we'll pass on to Dr. Koya. So over to you for the presentation. Yeah, thank you.
Thank you, Kamran, for and colleagues for having me today, this opportunity to present our work. Good morning, good afternoon, good evening to all who are watching us today. Yeah, I think the slide is clear. So as Kamran mentioned, I'll be summarizing some of the findings that we had from our study back in 2016-18 period in Kerala. So the context, just give a context. So Kerala is the southern Indian state which is known for its health model, which is good health at low cost. It's similar to Sri Lanka, and we have a similar. We have very in terms of child or maternal indicators and life expectancy. We have fairly very good indicators, which reflects the overall health system achievements over the last many years. And immunization was also fairly well. I mean, the immunization program started in the erstwhile Travancore, almost the same time when the vaccines were first available in the world. But as it happened in 2000s and later, we started to see a dip in immunization coverage, especially in some districts of the state. And Malappuram district is particularly important because it's the most populous district and it's the 50th most populous district in the country. In 2016, there were a lot of discussions with a couple of hundreds of cases of diphtheria and a couple of deaths in the district. And then this led to the state government look into the immunization status, doing some surveys in addition to the routine data that is being collected by the Department of Health. So we found that, children 5 to 10 years of age, that means there's a lag in the immunization coverage. We found around 36% of the children were not immunized at all. And the demographic health survey, the National Family Health Survey in India, also found that the average the immunization rate in state being 82%, while in the district it's 70%. And the number get translated into big difference because of the very young population in the district. And the urban-rural difference was also pretty high, compared to the state average. So what we did is that we, at that time, there was an opportunity with the WHO and UNICEF and health system coming together to generate a few studies across the world on various aspects of immunization. And we had this proposal on studying the social media influence on vaccine hesitancy. So what we did is that given that we didn't have much of quantitative data and still in the phase of understanding what's happening, we try to do a qualitative inquiry. We conducted in-depth interviews with physicians, modern medicine practitioners, as well as alternate medicine practitioners and link workers and other people in the community, from the health department as well as from the education department. And we also know that the religious propaganda in some places have played a big role in vaccine hesitancy. So we try to understand the perspectives and try to understand what is happening with all these different stakeholders. We also conducted focus group discussions with vaccinated and unvaccinated children's caregivers, basically parents and grandparents of unvaccinated as well as vaccinated children. We also assessed, analyzed videos available in YouTube and the Facebook pages, which were very popular at that time. So we try to analyze the content of such videos and try to relate it to existing content elsewhere. So to see what are the sources of those information and what are these videos effectively trying to communicate. We also analyzed the existing documents and guidelines and handbooks and information communication materials that is being used by healthcare workers in the field to see how equipped they are in terms of addressing the raising issue of social media and vaccine hesitancy. So to summarize, I mean, in our key messages, key findings from the study related to the social media content is that, and it's not surprising that, the messages are created or recreated using already existing information from the anti-vaccine portals elsewhere. The difference that happens is that it is being contextualized. As was mentioned before, Stephen, that they try to contextualize the information that is elsewhere available to make it appealing to the local community, local population, by sort of bringing in local examples and local incidents. And in the state, from the conversation, WhatsApp is the most popular means of campaign transmission of those informations, whether it is audio, whether it is short video. It's WhatsApp which is very popular, and we also saw that there are in terms of relationship between these anti-vaccine groups or social media and anti-vaccine campaign groups, there are a lot of advantages in terms of collaboration, which is based on some other engagements between these stakeholders, which we can discuss later. So the messages that we see in these again, not surprising. It's not different from the rest of the world. It's linking to cancers, it's linking to the autism and mercury content and all other contents which are used in the vaccine, linking to ill effects on human body. So it's basically trying to copy the messages that is available elsewhere, but then it is very carefully linking to the local language and local culture to make it very appealing to the local audience. The same continues sterilization, the same story of sterilization, depopulation agenda, and also sort of bringing in elements which are easily relatable to the local community. For example, saying that the vaccines are distributed in bus stations and railway stations without adequate measures, which will actually create problems in terms of efficacy and also creating adverse effects. So now when we, on the other side, when we look at the immunization information communication materials or handbooks for healthcare workers from the public health system, we found a totally different picture. The IEC materials are at least 1 decade behind in terms of content to assist the healthcare workers to deal with the vaccine hesitancy problem, especially in the context of social media. So, for example, the immunization handbook for medical officers, which is still the same edition is there. So it mentions just one sentence on social media, saying that social media is a very popular means of communication among the new generation. So unfortunately, we found that in the social media, especially the social media messages on vaccines, anti-vaccine messages are more popular among an older generation who is sort of taking decisions in many of the households in this part of the country. The social media messages, as I mentioned earlier, they are carefully crafted to bringing the parental fears and negative experiences and make it very, relatable. So they're bringing examples of past negative experiences, and this get transmitted easily because then people can easily relate it to some instance which has happened in their own household. For example, one of the respondents said that, one of their cousin's leg was paralyzed after taking polio vaccination, and after that incident, no one in the family is taking vaccination. So when they see these similar messages coming in social media to them, they can easily relate it to them. And without, when there is a vacuum, when there is a deficiency from the healthcare system to clarify this, the social media message get amplified. That's how it works. Of course, this is not new. Patriarchy in certain societies, which actually decides on healthcare seeking decision making in many of these households. One of the particular aspects in the study area that we found, which is like a link to migration and the thing is that many of the household heads are working in other countries. So what happens is that the grandparents are in charge of taking decisions in many of these households, and the grandparents have their own network of communication, and the messages that they get to know from their network is something which is distorted, and therefore they take a decision in vaccinating their children and grandchildren. So this is something which again had been a problem, because the parents are not there when the healthcare workers come to talk to the families, because they are working in the Gulf countries and other countries. So it's basically there is a communication issue with the parents or the father, and whereas the grandfather or grandparents are available there, they take the decision on behalf of the parents. So this was again complicating the already existing issues. Most importantly, from our study, what we felt was the trust and healthcare workers' capacity and the trust on the healthcare system as such. So very often we found that healthcare workers themselves expressing their inability to address some of those issues, in terms of queries that parents have after going through the social media messages. So, the knowledge gap between the parents and the healthcare workers at the ground level has widened. So what happens is that, the parents come up with questions based on the messages that they receive, which is beyond a healthcare worker at the field level to answer. And quite often, at least in some of the instances, even medical officers find it difficult without referring back something and to reply and address some of those queries. So this gap has widened with the social media there, and the widespread campaign, especially through WhatsApp, which is like very fast, reaching to hundreds of thousands of people in one day. So I think that has actually been a big issue. Of course, there was already an underlying issue of trust, because healthcare workers focus only on immunization. That's not a complaint only in Kerala. It is, I think we have also seen that happening in many other papers across the globe. So there's already a trust deficit, and adding on to that, when the social media campaign adds to the trust deficit. Of course, with all these limitations, there have been also a delay from the government side in addressing and even understanding and recognizing this as a problem. For example, simply, the Kerala Health Department, the Facebook page was done only like 2-3 years back. So these anti-vaccine social media pages and YouTube pages were existing for like many years. And therefore, this delay in the response also was an issue. But of course, now there are a lot of efforts in trying from the government health department as well as from medical fraternity to come forward and clarify things as and it appears in the social media. Of course, the alternate system practitioners and to some extent the religious leaders were also involved in propagating these messages. So again, it is not something they create themselves. they depend on many of the existing materials that come from other countries and other contexts, and then they try to relate it, and then they try to propagate it. And of course, some of the alternate medicines practitioners do not believe in vaccines, and many of them are actually working in the government department. So that's a critical issue, because people working with the government system, practicing a different system of medicine other than modern medicine, advising the children who are often taken to these practitioners for small illnesses, they advise against vaccine. This is because within the health system there are two advices that parents receive. So this is also a critical issue, again amplified by social media. So it emphasizes the importance of communication at various levels between practitioners, between streams of medicine, and between health system and the families. So what we found in summary is that there is an existing trust deficit, but this got amplified by the messages from social media campaign and anti-vaccine groups, which actually amplified the existing trust deficit, which actually exposed and exploited the existing issues within the health system, the capacity issue of the healthcare workers, and the gap in service delivery, all those things. For example, even as an example, in this particular district where we had this study, the healthcare center availability is almost only half of the state average. So there is already an existing healthcare infrastructure issue, which actually creates a sort of apathy or lack of trust among the community, which these groups, the social media campaigns, effectively used. But of course, as I mentioned, there have been a lot of response, a group of Kerala doctors coming together and having creating propaganda and Facebook pages to answer as and when these things come up in the social media. And from our part, as part of the project, we also created a compendium which actually brought together all the questions that we heard from the field, the concerns, the doubts, the misconceptions, and tried to answer with the help of a panel of experts. And also we created a mobile application in the local language and in English, which actually help family members or parents to actually ask questions and also to search and find answers to their doubts. And this also can be used by healthcare workers in the field who can, in the field themselves, they can actually find answers to many of the questions that come in. Anyway, the healthcare department in the district did a wonderful job. There were an intense effort involving all stakeholders. We just have the next round of a demographic health survey, which shows a significant improvement, I should say, in the district. Almost 10% increase in 10% point increase in the vaccination coverage in the district. So I will stop here, and maybe we can take questions as and when we have them. Thank you.
It seems Cameron is not on. Okay.
Yeah, I think we might have lost Cameron. Was Heidi? Was Dr. Larson going next?
Yeah, can you all hear me? Can you all hear me there? Yeah. Okay, yeah. Brilliant. So I was just saying thank you very much for that presentation, Dr. Shaffi. Very interesting to bring in that HCP perspective in terms of the lack of training. They're not able to counter anti-vax messaging and the effects of that as they go on and interact with their public in their particular health-giving kind of setting. So the kind of vitally important point you've raised there. And also this app that you put forward, really thank you for putting that forward, because part of the day today is really about discussing, or at least trying to catalyze the discussion towards more of a solutions kind of based or perspective. If the problem is within social media, then we can obviously have a look at that and have a look at potential solutions from within social media. This app that you put forward is a very interesting approach. So thank you for that. I'm sure there'll be a lot of questions coming through. We've been joined by Dr. Anatole Miranda from Uganda, Stephen Bramia from Canada, and various other people. And I think some questions are coming through, and I would urge the audience to please do send in your questions. We will endeavor to give you a shout out and the actual question itself. Before we get to the Q&A, I think we're going to have a few words from Professor Heidi Larson, one of the co-founders of the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine, very, very vocal advocate of issues around vaccine hesitancy, and also on the editorial board of something called the Healthcare Confidence Fund, which I'm sure will throw some questions in Q&A. But Professor Larson, over to you for a few words.
Okay. I'm going to just say a few words about some of the contagion aspects of not just COVID, but the social media. And thanks to all of the other presenters. It's fascinating, and I have a few shared thoughts on it. You can see the slide, yeah?
Yeah, perfectly.
Okay, great. It's hard to know because you can't from this perspective. A few years ago in 2018, I had done an article. A lot of people were thinking about, are we ready for the next big one, particularly after the H1N1 pandemic in 2009 and then Ebola, Zika. We were trying to make sense. And the thing I was most concerned about was viral misinformation. But it has turned out to be far, I would say, worse than expected. One thing we've seen in our Vaccine Confidence Project, which I founded 12 years ago now, and we've been following closely with surveys, with media monitoring, online news media monitoring, but increasingly social media monitoring. COVID sparked an exponential increase in where vaccine issues came up. I mean, it has embedded a lot of different groups that never talked about vaccines before COVID, and that's been in good ways and bad ways. I work very closely with engineers, a lot of computer engineers on dynamics and spread of social media over time and place and how they're changing. This is a collaborator, Neil Johnson, who did a fascinating piece of work on, this was Facebook groups. Each blob here is a group. The green are undecided groups when it comes to vaccines. The blue are pro-vaccine and the red are anti. Now, what's been fascinating and important for us to learn from here is that the pro group, although the individual numbers of users are nearly 7 million here, and among the anti groups, it's just over 4 million. This relates to some of the comments earlier about how responsive the more anti side is to the specific concerns of the public, rather than promoting more generic positive information. And what that means is, like, if you have 100 pro people, they'll group into one group. And if they're more on the anti-critical side, you have 100 of them, they'll break into 10 groups, making sure that they're out there responding to every little concern that the undecided people have, to say, we understand your concern, you're right to be worried. And what in the end is, and the finding of this paper was that the pace of, quote, recruiting the undecided people out there was 500% times faster among the negative than the pro group. So we have things to learn from that being relevant to where the conversations are and what the concerns are. So volatility and the change of time is another thing that in this paper particularly, I just wanted to bring attention to David Broniatowski, my co-author on this piece, who's also done an incredible amount of important work on looking at even the weaponization of some of these dynamics with social media, both for the information itself, but for the also, as has also been mentioned in the previous presentation, the organizational capacity of social media, which I think there's a lot of focus on misinformation, but not the other characters and assets of social media that can be used for good or not. I am a fellow with the World Economic Forum, and one of the things we're doing is there's been a lot more. I don't think the World Economic Forum has ever been so interested in vaccines as they are now, for their companies, for their colleagues, for their own gatherings. And one of the companies that does massive global social media listening, particularly for reputational risk, for other product monitoring for companies, did a pro bono project with the Vaccine Confidence Project on what are the nature of the conversations around the world, around the COVID vaccine. It was highly varied. This is online in the World Economic Forum site, the report. But again, it was billions of posts. But to me, one of the most interesting things was the word protect and protection was the most frequently raised term in social media conversations. And from our research on dynamics, it triggered the most positive, open conversations, whereas where the term or related terms to moral obligation to get vaccinated immediately either shut down conversations or started negative ones. So finding what those trigger terms are that tend to turn a conversation more open and positive versus triggering absolute shutdown or triggering negative conversations are really important. What are those provocative, positive and negative terms or images? We also look over time at how these narratives on social media were changing. We monitor over the last couple of years, for instance, for Public Health England, we're doing biweekly reports. They've slowed down now since COVID has waned a bit, but just to give them briefs on what we were hearing across the conversations. And what was interesting is last May, vaccines were barely in the conversation. It was much more anxieties, concerns, discussions about masks, measures like social distancing, lockdown, and the number of cases. And then there were other conversations around needing support, needing stimulus, support for particularly furlough and jobs, and how long is this going to go on? And then by the end of the year, it was just flooded and continues to be very much around the whole vaccine issues. So these tendencies change over time. We do a lot of collaborative work with UNICEF, with WHO, with companies, with governments, depending on their different needs or issues. But we're looking for, there are good bots, as we say, and bad bots, the robotic. And as with the work with David Broniatowski, they talk more about weaponized bots, but there are also good bots. So I think looking at what is the tone, the sentiment. And we've looked at multiple countries and regions because there are different characteristics, looking over time. And we saw that for instance, in Europe, there was also, and again, this was raised in earlier presentations, different government announcements or either changes in policies always are the ones that provoke issues. In Italy and Germany, there was a peak, and that was government announcements about new restrictions. And a lot of the more negative conversations were very tied to policies or government proposals. And then in the back, on the sidelines, you see all these social media images saying, you know, if you allow the government to break the law during the emergency, they'll create emergencies to break the law. This was the kindest of the more critical images that we saw there. In South America, we listen across regions, Ecuador, Peru, and Brazil. Again, it was very much, the conversations were not so much specific about the product earlier on, which there's much more product-specific commentary now, particularly with vaccines, but earlier it was much more about overall response. Huge political polarization in Brazil, which continues to the day. But a lot of the countries around were interesting. We're watching Brazil and what Brazil thought and what Brazil did. So there's a regional dynamics as well as national and subnational. With Africa CDC, because we've been working, as I mentioned, very globally, we've been collaborating on public perception and sentiment monitoring. We did a big 15-country study and about to do another one, including with healthcare workers, to follow up and see what changes there are. But we found that the susceptibility to COVID-related disinformation did have a significant impact on potential uptake. And some of the dominant perceptions were about foreign actors planning COVID, about trials being, abusing and using Africa, and then the whole 5G COVID-19 link, which is not at all Africa specific, that's been global. And in fact, I remind people that there were anxieties about 4G causing H1N1 and 3G causing SARS. I mean, these things go way back. One of the things we've seen, particularly in the last year and a half, is that the discussions about routine immunization have pretty much fallen off the map. It's been very much COVID specific. And there is a concern. I mean, in some ways that's good when it comes to the negative issues, but we are starting to do some research to see how has this landscape of very dynamic, sometimes toxic, sometimes supportive social media will affect overall sentiments around vaccines when we start to catch up on all the lost immunization coverage. I just want to pick up on Stephen's earlier mention of the global monitor. Actually, I think it was more like 149 countries, but that's a small thing. But basically, in the Welcome Monitor, the vaccine questions actually were our Vaccine Confidence Index questions. And that was particularly because we did have multiple years before and have since done more. So they have a lot of other questions in the monitor, but the questions about vaccines, perception of vaccine safety, effectiveness, and importance were taken from the Vaccine Confidence Index. And last, which we launched in 2015, and the monitor was in 2018. So last, we did a big analysis of all of our Vaccine Confidence Index data, which was a metric we developed in the Vaccine Confidence Project to measure confidence over time, recognizing how volatile people's sentiments about vaccines were becoming. And that predates COVID, but it's become hyper volatile since COVID. And we looked at comparing, including the 2018 confidence index questions in the monitor, but going back to some of the same questions we asked in 2015 and other years, and then up to end of 2019. This is looking at a number of countries where we had data from 2015, 2018. The concerning thing we saw in this change is dark red is the more disagree that vaccines are safe, and the darker the blue, the more strongly agreeing that vaccines are safe. Our concern was, one, in 2015, we identified Europe as being the most skeptical region in the world when it came to vaccine confidence, with France being the global winner in terms of 41% said they did not agree that vaccines were safe. And that was significantly higher than anywhere else in the world. There's been a lot of work in Europe collectively to improve confidence. But in the meanwhile, there's been a diaspora, or a sentiment diaspora on language diaspora. So we see, for instance, in Francophone Africa, if you look at just Africa on the left map in 2015 and the right map of 2018, the yellow, which is the more negative than the blue, a number of Francophone countries in Africa have become more skeptical. And some of the speed of this change is very much due to social media. There was a previous presentation looking at considering, well, what is the impact on vaccine uptake of all this misinformation? And since we get a lot of questions about that, we did an 8,000-person control trial with 4,000 in the US, 4,000 people in the UK. We showed 1,000. Well, we did interviews with all 8,000 asking about COVID in general, but within that, would they take a COVID vaccine if it was recommended and available? And then we showed 1,000 on each side of the fence, of the ocean, I should say, positive, straightforward information, and 3,000 different types of the 5 most frequently circulating negative social media posts. Now, and then we re-interviewed all 8,000 again, more general questions about COVID, and within that, again, asked about willingness to take a COVID vaccine. In the UK, before, 54% said they would definitely accept a COVID vaccine. And the US, it was 41.2%. But after the exposure to the 3,000, actually across the whole 4,000, there was a over 6% drop in both countries in willingness to take a COVID vaccine. I should add that for the positive, straightforward information, there was absolutely no impact. They didn't increase their interest, and thankfully it didn't decrease their interest. These were some of the 5 most frequently circulating posts that we used. And what's interesting is, for those who say that these are anti-science sentiments, we actually found that the image, the DNA RNA image here, was the most compelling in terms of changing people's minds. Even though the interpretation is wrong, the mRNA vaccine does not change your DNA, but it made it look like a textbook image from some genomics textbook. And that actually had more impact than some of these other images. I'll just, if you want to learn anything more about this, I recently came out with a book, Stuck, and as you can see, it's also on emotional contagion and volatility, but it reviews our last, basically I wrote it learning from a lot of the 10 years of our work in the Vaccine Confidence Project, and including how the introduction of digital and social media has changed. I meant just my last slide here because I was specifically asked to talk about the Alliance for Advancing Health Online, the Vaccine Confidence Fund. Some of you may know that earlier in the year, Facebook and Merck together put about $30 million into a fund, which they called the Vaccine Confidence Fund, to try to stimulate research with social media for good. So in the landscape of so much attention focusing only on the misinformation and negative impacts of social media, this was an effort to say, okay, this is also a huge resource. We want to stimulate science and research that is looking at ways that social media can be used to shift the landscape around vaccines, to be more confident, to be more open. We just announced this past week the 33 winners of the first round, the first call for proposals. We had over 400 applications, and these are small grants that could, well, not that small actually, but small in the sense of they needed to turn over a deliverable by February. So it's very quick turnaround. They want to show some quick impact in the context of COVID. But this fund lives in what is being built as an alliance for advancing health online. This specific first call was for targeting the, try to stimulate positive science and possible interventions in the COVID context. But moving forward, the idea is to look at vaccines more broadly, but even beyond vaccines for other health interventions, basically to shift the landscape to be more resourceful in positive ways. The alliance is being built, as it were, kind of, what did they say, building the ship while sailing. We went front forward with the Vaccine Confidence Fund to get some things going, while the alliance itself is building its base. And we have another call about it next week. The World Bank has come on board with some good resources, and there are a number of other partners. Watch this space. It is, as I said, building while we're trying to move ahead at the same time, but happy to, I don't know how many questions I can answer, because again, it's in process, but I would welcome any thoughts from the audience. Thank you.
Thank you very, very much, Heidi, for that wonderful last slide as well, in terms of potential solutions to all of this kind of toxicity that we keep charting and seeing the ill effects of. So I think congratulations to your 33 winners. I'm assuming you've been knee-deep in grant review processes in the last month or so. We were aware of the call to arms for the fund, but we just thought we'd let it kind of go through its review process. So I'm sure something good will come out of that. Thank you very, very much. Very interesting to see that genomics slide having maximum impact, this kind of highlighting the science populism that's kind of taken root on social media platforms. But thank you for that. And thank you to all the speakers for the wonderful presentations. Could I ask everybody to just put their cameras back on for the Q&A, and we'll just get stuck into that, if that's okay. We're being also joined by Professor Charles Wiysonge there from the South African Medical Research Council and the Cochrane group in South Africa. So hello to you there, Charles. I know you're one of the co-authors with Stephen, Dr. Wilson, in terms of social media and vaccine hesitancy. Thank you very much for joining us. Hi there, Charles. Thanks for that. I think we've got some questions that have come through from the audience. We will get to those in a second. I would encourage our wonderful audience to send in questions, put your name, affiliation, country, organization, and we'll give you a shout out and weave those questions in. From our point of view, part of this session really is to kind of build on the positivity. I look at recommendations, solutions to this obvious problem, and a problem that's been so well documented by all of you. So just going back to the first presenter for the day, and I'll just kind of set the tone for the Q&A. So Stephen, Dr. Wilson, in your paper with Charles, as far as from what we've understood of it, some of the there are a lot of findings in there, and you mentioned a lot of them in your the slides and the presentation, looking at foreign disinformation campaigns, the associations with the drop in mean vaccination coverage, looking at social media in terms of how does that impact offline organizational activity? Is it predictive in terms of the belief taking hold that vaccinations are unsafe? All of these kind of findings. The implications of those findings lend themselves to recommendations. One of those kind of recommendations is the need for coordinated action, removing anti-vaccination content from social media platforms. I wanted to ask you this question. On that basis, whose responsibility is this? It's a big question in a way, because we're talking about, are we going to talk about regulating the internet, censorship? Whose responsibility is this? We've just heard from Professor Larson in terms of this kind of fund that's kind of pushing forward to try and bring potential solutions to the fore, at least catalyze that. So I'd like to ask that question: whose responsibility? There is an urgent need for this kind of coordinated action to remove harmful. You've shown the links. It's anti-vax content from these platforms. Whose responsibility is that? Stephen, I'd like to ask you that first.
Well, there's a couple different angles there. So the first one, I think, is it's very easy to go to the social media companies need regulated. Because we can't expect a private actor who's profit-driven to be operating in fundamentally good citizenship faith. Like, this is why we have regulation across any field. But regulation is also problematic. How do you effectively regulate a company that has 3 billion users in every country on the planet? Like, what is the appropriate regulatory body there other than the United Nations? Perhaps, who gives them the power to actually do it? And it becomes a huge thorny problem. So to focus on things that we might actually be able to do, I think one of the main ways is at the very tactical moment is just to keep the pressure on social media companies to take down content like this, that, spreading misinformation and lies is not covered by free speech concepts. Like, it's the classic yelling fire in a crowded theater example. And we know systematically that deplatforming works, that when you say you're not allowed to, we're banning your accounts because all you do is post misinformation, those individuals disappear, like, from the public consciousness. The secondary thing to talk about a bit is the role of intentional malicious actors, because there's a big distinction between people that are, so to speak, normal people, that they may be wrong, but they are genuine. That is very different from an intentional malicious actor spreading false information. And those malicious actors tend to, and this is in particular pseudo-state organizations, in particular out of Russia, that inflate existing content for political gain. And that's something that has far blunter, more classic tools of statescraft, of this is something that the government, the Department of State, what have you, of various countries can put real pressure and efforts into. Hey, Putin, stop doing this. We know you're doing it, and we know why you're doing it. We don't have to prove it in a court of law level of like regulatory capacity, but we can put diplomatic pressure on countries to stop doing things that are harmful for political reasons.
That's a great answer, Stephen. Thank you for that. Dr. Shaffi, I wanted to ask you, in terms of anti-vax content, removing, you need an element of, how to put it, scientific knowledge to be able to discertain, perhaps in the initial sense, what is anti-vax and what is right and what is wrong. Is that a potential role for your HCPs? And would that then address the gap that you've highlighted in terms of their own ability to counter-argue anti-vax to the anti-vax crowd? Is there a role for the HCPs? Is there a responsibility within that?
If we look at the social media content, some, as I mentioned in the presentation, quite often it's very contextualized. I mean, of course, it draws lessons and examples or basic frameworks from existing materials, but it is largely contextualized. Otherwise, it doesn't get accepted. So I think the local departments of health have a critical role here. To begin with, they should actually have a cell or a mechanism to monitor the social media content. I think that's the first step. And also, like, I have some doubt when you say that regulations with the social media platforms work so easily, because we have seen in many examples in different countries, like, social media takes obviously different positions depending on various factors, including the governments. So I think it's important to have a local level a health department guided a cell which can actually monitor the content and then work with the local social media platforms to see, like, especially following the influencers in this world, so which will be and as far as withstanding the political dimensions of, keeping away the political dimensions of such posts, I think the influencers are far less, at least if you look in a very specific geographic area. So that should be something which can work out if the local health department work with the local healthcare providers as well as the social media platforms.
That's a great answer. Yeah, thank you for that. So kind of a shared responsibility, really, and a bit more of a kind of partnership-driven approach, really, between the HCPs, local government. And you mentioned these influencers, and you mentioned there's loads of stars in the internet that should be harnessed, could be harnessed to become advocates. And you're certainly starting to see that somewhat on the internet at some level or another. So that's pretty good. The positivity, kind of the positive stories that need to be put out. Charles, do you have anything to add to that from what Susan was saying, or in terms of your view on this from the South African perspective?
Yeah, I think there's probably no one size fits all that one can use to control the messaging on social media or how to regulate that. But I think I agree with what has been said, and I think we probably just need to continue thinking on the best ways to regulate this, put in each national environment, each government trying to bring out its own ways of regulating that, and of course at the international level, seeing what more international organizations can contribute to that, and putting pressure on social media organizations to regulate their content on their sites. Thank you.
Thank you for that, Charles. Heidi, I'll come to you. I'll come to you last, because you've shown a potential solution. $30 million has gone in with Facebook in this particular fund. You've already given your winners out. You're already listing your winners out. You mentioned it's growing, so the World Bank are now getting involved. I'm pretty sure so it'll probably grow more than that, and hopefully it will. Kenneth Hartigan-Go has put a point in there. Dr. Hartigan-Go's ex-government of Philippines, was in the Ministry of Health, and now was one of the directors at the Asian Institute of Management, a very prestigious business school in the Philippines. He's asking, what should be the government's role to deal with misinformation, and when government when they don't act swiftly enough, and private sector has to then step up. What does that tell you? It's a story of apathy at government level, but they do need to step up. He's asking the question, what should be the role of the government in that? And I wanted to ask you that, because you put forward a solution to some of this issue of this recommendation in terms of whose responsibility it is, and they seem to be taking that responsibility in terms of the fund. What can the government do, in your opinion, Professor Larson?
Well, I think that, I'm very happy to see Ken online today. We've collaborated on a number of things, and Ken definitely knows the front lines of the negative impact of social media when it fires up in some vaccine issues. I think picking up on just what some of the other panel participants have mentioned is the importance of working also with, I think we all need to look in the mirror and see what we can do better. I think it's really scapegoating to point all fingers at the tech companies. They absolutely have an important role in this. I personally think that where they can have the most impact is at the back end of the computer and the algorithms that amplify this information. If all they did was rein that in, or certainly the pieces of misinformation that are more dubious, to slow it down, I think that would be far more impactful. Cherry picking, or maybe that's not cherries, it's like the tops of weeds instead. The pieces of misinformation, particularly, I've spent a lot of time in roundtables with the different companies, and it's not easy. Because right now, the stuff that's taken down is overtly harmful. It will kill, or it will, but there's a whole other massive amount of very doubt-seeding, questioning, provocative, negatively provocating, but not overtly harmful. What do you do with that? Well, in my mind, when it's in that category, you go to the back end and slow it down. And from our end, from a health professional side, I think we need to catch up. We are way behind from health departments, health. I was impressed that that Dr. Shaffi was talking about the health department. I don't know too many health departments that dip their toe near social media. The great advances I see, or the perceived great advances, are, using SMS for appointment reminders. A lot of health departments are hyper anxious about going in that space. It's toxic, it's emotive, it's not science, but that's where the world is living and the world that we need to connect with. So I think we have a huge responsibility for getting with the program, as it were, and working on building resilience. And to come back to the question from Ken, government needs to take their own responsibility, because frankly, we've got some situations in government where they're not spouting the most scientifically accurate, appropriate information themselves. So, and that's even harder for companies. You've governments wagging their finger on the one side to say, take down the bad stuff, and on the left hand, they're contributing to it. So I think governments need to look at themselves, but also I think invest a lot more into their health departments and into their services to really understand and work with this environment that we're going to live in, and it's not going away.
I think that's a great answer, a very honest answer, actually, Heidi. There, thank you for that. I mean, it echoes something that Dr. Shaffi you'd said earlier in terms of governments or public health systems, at least in certain areas of the world, lag behind in terms of adapting technology or technological movements, and particularly social media movement, and then they magnify this by the unintended kind of miscommunication by their own official sources. Just picking up, kind of echoing what you're both saying there. So there are responsibilities there. Kenneth has come back with a very interesting point. I met Kenneth had the pleasure of meeting Kenneth in Geneva a few years ago, and we had a very long, frank discussion at the time. He's made a very interesting point. He's saying that social media sites rely solely on ads, and this kind of looks at kind of perhaps building lobbies to counter all of this. Will the private sector be willing to pull out of marketing on sites that promote misinformation? So that's kind of, build a lobby, don't use those platforms that are putting out misinformation. Very, very interesting point I felt there. There are some other questions that have come through on this kind of whose responsibility theme, if you want to call it the theme. Dr. Stephen Bramia from Canada, he's putting in that non-educational anti-vax campaigns, especially in developing nations, must be a grassroots effort with cinema vans, organized association of community elders, chiefs to inform their communities about the lies associated with vaccines. And he's made an earlier point that really it's in his opinion, the potent weapon, and one of the potent weapons against kind of anti-vax campaigns or information flows is the kind of incorporation of the positive outcomes and biological importance of vaccines into all educational systems. I guess he's saying catch them early, and he's saying this knowledge has to be through from grade school all the way through to higher school. So the earlier we can make the case, perhaps the kind of, in terms of the positive case, the better it will be. And that's a kind of an interesting point there. So perhaps changes to the way education is rolled out in certain countries. John Gibb, who's also joined us, long illustrious career at DFID. So hi, John, nice to see you on the Connect session today. John and Stephen were together making a point really about state-backed religions or religious groups, organized religious groups. How do you envisage that kind of coming? And I'll ask that to Dr. Shaffi, because you raised that point in your presentation. How would you look to involve them? What more can they do? That's definitely a group there that's involved in misinformation. The vaccine has pig inside it, as an example. What are your views on that, Dr. Shaffi?
Hi. So yeah, so definitely there has been attempts from some of the religious teachers and groups, especially some of the groups, which they hold on to some of misunderstanding and misconception regarding vaccine as such. It's not just any particular vaccine; it's as vaccine as such. So it's sort of a resistance, you can call. So that has over the period, I mean, especially the district that I was mentioning, it was largely a minority district, and one of the apprehension was that it is mostly to do with the religious beliefs. But our study didn't highlight that as a major factor. But in fact, what we found was that it is more to do with alternate practitioners fueling some of those parallelly. Of course, there are underlying beliefs by certain groups that vaccines are not to be used. I mean, similar to blood transfusions. Similar to blood transfusions are prohibited in some of those belief sections. But again, we have seen largely changes over years, especially with education, as you rightly mentioned. Your education right from the school and above that has a big impact in changing the understanding and perception about vaccine as a prevention, and it is to protect the life. So I think that has gone in, but at the same time, parallelly, we saw the alternate medicine practitioners and also some lobby, the typically the naturopaths and certain groups which are not specific to any particular location, but it is globally they are connected. So that actually has had an impact on changing the mindset of even younger generation.
Yeah, I mean, I'll ask that same question to Charles in terms of religious groups. I'm saying this because in the UAE, I remember reading that there was an actual Islamic fatwa that came out by all the mosques together that actually said that if you, from their religious perspective, if you are carrying for COVID, if you're asymptomatic, you're infectious, you've given the infection to someone else, they die, then this fatwa covered that you are really in the wrong to do that. And on the basis of that, they were kind of able to get a very, very high vaccine coverage rate in the initial stages of the vaccination programs that went out. So there's obviously a role for them to play. From a South African perspective, Charles, are there religious groups that you would look at that might be someone you could bring into this to kind of for more of a positive kind of input?
Yes, some people we do find, and in case of COVID, there have been a lot of misinformation and conspiracy theories that link to religious beliefs. And we've had a lot of those also in South Africa. But what we've done in South Africa, there have been, of course, like in most countries, a lot of stakeholder engagement, and some of that is with religious bodies, with traditional leaders, and all of that to ensure that they engage with their communities. Some of them well, and one of the things that has not worked very well because of COVID, there was lockdown. Even though there were some of these churches now had to go online, but it would have been, and that was one of the, this is probably a diversion, but just to tell you that we have engaged a lot of them, but some of them say, well, you are locking us from going back to churches or going back to our religious groupings. Where do we meet these people? But of course, there has been a lot of engagement of religious leaders in the South African context and other stakeholders.
Fantastic. Thank you for that, Charles. I think we've got a few minutes left. So I just wanted to come back to the kind of recommendations that were implied in Stephen and Charles's work. So I think they have a lot of resonance with the other presentations as well. We covered the need for coordinated action, removing anti-vax content from social media platforms. Whose responsibility is that? There's a mixed bag of answers, but it's there in terms of ranging from ourselves, the way we interact, through potential lobbying for, don't go onto those sites, don't spend your time and money on those, all the way to government, local government, and their role in terms of their HCPs and bringing all of that into this kind of removing anti-vax content from social media platforms. Some kind of positivity there in terms of this HCF fund, the Vaccine Confidence Fund, and we look forward to seeing some of how those winners develop. So that's the first point. The second point, and this was made by Stephen and Charles in their paper, really, the need for coordinated action against the sources of intentional anti-vax disinformation campaigns abroad. How do you do that? I'm going to ask that to Stephen. It's a huge point. You've mentioned Russia. We've seen what happens when disinformation occurs in elections. We've all suffered that for the circus that we've been watching in the last few years, I'll put it politely, hinged on or underwritten by a lot of misinformation campaigns, disinformation campaigns, all of that. So there is a need for coordinated action. We can see what happens when it's not checked against the sources of this kind of intentional disinformation coming from abroad. How do you do that, Stephen? What's your take on that?
I think the first step is appreciating the political dimension of what's going on. You don't have millions of Russian bots doing this because Putin hates vaccines. There's political implications going on here that build into long-running political conflicts and issues. So like our work initially, because we were pre-COVID, we were looking at Russian-pushed anti-vax content in Africa in the instances of the Ebola outbreaks, where the focus of it was on, you can't trust the West, you can't trust Western doctors, you can't trust experts, and this has nothing to do motivationally with health or vaccines. What it has to do with the overall narrative of you can't trust the West. And this is one dimension that we're pushing that on, and there's a dozen other dimensions. Now, over the last year and a half of COVID, that dimension has become way more important than the other dimensions in a lot of ways, but it still has that political motivation underlying it. And you especially see that with the rise of the so-called vaccine diplomacy over the last year, where with one hand, the pseudo-state actors are pushing these narratives of COVID isn't real, of the West invented it, it was a CIA plot, and all sorts of other stuff. And then on the other hand saying, and you can't trust their vaccines, but you can trust Sputnik. And we would like to give you 1 million doses of Sputnik in exchange for X, Y, and Z. And this brings it really back into a very realpolitik terms. These are political actions with political motivations, and they have political and diplomatic solutions, or at least there's a toolkit there that isn't simply a how do we grapple with billions of tweets. It's a different story of how do we grapple with a state actor who's pushing misinformation for political goals. That's been going on for hundreds of years. These are tools, these are things we have a toolkit for.
Well, that's very interesting perspective on it. I was going to ask that question, but I'm very aware of the time, which I think we're coming to the end. There's a question from the Sri Lankan Ministry of Health, Dr. Hasitha Tissera, who very kindly joined us early evening or late evening actually in Sri Lanka. He's asking, do you see COVID-19 treatment lobbying resulting in vaccine hesitancy, especially amongst the youths, mostly using social media? So it's basically asking that this whole kind of positive lobbying, has that in itself resulted in any kind of discernible vaccine hesitancy in the youth? I'll ask that to Heidi. Maybe you've got an overview of that from your work. If not, but I'll just ask you: is there a youth-specific effect? Where we talk about positive messaging?
Yeah. And then I'm going to have to jump into another. Excuse myself for another meeting. I think there is one of the phenomena we're seeing with youth, and youth is kind of a broad term, but even though in the global scheme it's one, we find that youth are the most, certainly in the context of COVID, have been the most critical or hesitant. And I think I understand some of the reasons, but it depends we see also a difference between the youngest, like the 18 to 20 versus the 20 to 35. And some of it is related to where they were in terms of, as they call them, the digital natives. Because I think the first generation of children and young people to get social media, it was like the honeymoon period. There was nothing that could be wrong. It was like the truth. And I think this emerging generation is much more critical, self-critical of, knowing that not all social media is good, and they're more cautious. So I think and I think it depends on the setting. We see huge diversity in different settings in terms of, but it can be used for good. And I think, if we can use also the organizational power of social media to give that kind of quantum shift, I think we can, and that's what the Vaccine Confidence Fund, as you mentioned, is trying to stimulate these positive, innovative trends. And on that positive note, I'm going to say thank you so much. It was really a pleasure to be on the panel with such an esteemed group, and also appreciate the large number of people who are participating. Thanks so much.
Thank you very much, Professor Larson, for making time. I know I have to apologize because we've gone over time, so thank you very much. Feel free just to log off. I'm just going to quickly say goodbye and everything to everybody. We've come to the end, and I apologize, we're a few minutes over. Charles, I know you're joining us from South Africa, so I appreciate that. Boston, it's early morning for both Stephen and for Dr. Shaffi as well, but thank you very, very much. Some great comments coming through in terms of, so Ebua Fung, interesting discussion, much effort is needed to inform those still in doubt. Dr. Stephen Bramia, great discussion. He's also saying, what about inviting government authorities to this medium and have them inform the public about their vaccine policies? Well, this will be recorded, edited, and we'll be using the assets to kind of send out on social media itself. So there's obviously a positive use for it, but we will be trying to reach those government authorities as well with this. Some Dr. Kenneth Hartigan from the Philippines, great discussion. Thank you to the panelists. He has to go, so he's saying thanks. Thank you to everybody. I know Dimitar Tonev had asked a question right at the beginning, which got buried, but I think Dr. Wilson Stephen, I think you'd answered Dimitar's question in terms of were you differentiating between traditional anti-vaxxer sentiment in terms of well-justified skepticism related to a particular generation of leaky vaccines and intended value as a universal vaccination tool. You'd asked that question. I think you'd answered that you'd answered that in the chat box actually earlier, so thank you for answering that. And you said you did not distinguish between varieties of anti-vax content. It was looking really at the effects simply on the basis of foreign source disinformation levels in general, a negative discussion in vaccines in general. I think from here it's very obvious that we can make recommendations all day long, but there is an appetite now that's starting to take hold if organizations such as the World Bank, dare I say it, Facebook, they're all kind of coalescing around trying to find solutions. It's early days, but it's certainly something a little bit more positive in terms of movement in this vaccine hesitancy, vaccine confidence argument. I'd like to say thank you very, very much to all of the panelists. It's been a wonderful session. I wish we had a little bit longer because the audience is starting to send in questions now. Anatole Miranda, Dr. Miranda from Uganda, very interesting presentations. Thank you to the panelists. Lucy Goldsmith, lots of interesting perspectives. Thank you. So a lot of kudos and claps for you all. I think on that basis, I'd like to say thank you. I think we should kind of call it a day, perhaps, because I'm going to get in a lot of trouble. Dr. Sarah Shaffi Al-Sakaf from I believe, the Ministry of Health Saudi. Thank you for this great discussion. It's been enlightening for me as a young physician and epidemiologist. So that's all great. Jimber, Lord, some excellent discussions. They're all coming through. Thank you very, very much, guys. Thanks a lot. I think it's a work in progress, and I think there's going to be a lot more of these kind of, or there needs to be a lot more discussion around these points before we get to a kind of solution, as it were, in terms of combating this phenomenon. So thank you very, very much indeed. A round of applause.